In this video, we are going to discuss about history and physical examination and the forensic evidence and their consent regarding the sexual assault patients. So in history, before we begin the interview with the patients, we must introduce ourselves and we must express the regret about the assault and provide reassurance that medical and psychological needs will be addressed properly. So we must maintain a professional and caring attitude. A patient's response is affected by the physician's attitude. A physician's shock or outrage may increase the patient's concern about physical injuries or cause the patients to feel marginalized. Questions perceived as critical or judgmental result in feelings of guilt or shame and interfere with the survivor's ability to provide a thorough history. Calm reassurance will facilitate the history examination and collection of evidence. Ask open-ended questions about the sexual history. For some women, sexual assault is the first sexual encounter, and for some lesbian patients, it may be the first sexual encounter with a male. Obtain a thorough past medical history and general assault description and then ask the patient about the injuries. In some instances, triage nurse will have obtained the past medical history. In the ED with the sexually assault sexual assault nursing examiners, right? Nurse examiners. So these services will be guiding them. So the patients in ED with the same services, a detailed assault history to help guide the evidentiary examination will be obtained by the same. If there are no sane services but a sexual assault advocate, police representative, or a social worker is available, have those individuals in the room during the history taking so that the patient does not have to repeat the information. So most authorities caution that the chances of finding a forensic evidence more than 72 hours after the assault are slim. So a forensic examination is not necessary if more than 72 hours have elapsed since the assault, unless specific state allows the evidence collection up to 96 hours after assault. So, okay. So consent for forensic examination. Have the patient sign consent form for forensic examination, collection of evidence, photography, transfer of evidence to law enforcement authorities. Most hospitals have a pre-packaged rape kit with equipment and directions regarding this. So, however, check with the police if you are unsure about the utilities. Okay. So, and some police departments may require use of a specific kit for their prisons. Hospitals will allow the storage of a rape kit for a specified period of time while the patient decides whether or not she wishes to make a police report. In such case, encourage the patient to consent to the foreign exam. Not every part of the forensic evidence kit needs to be used every time. Tailor the collection of evidence to specifics of the assault. If more than 72 hours or 96 hours according to your hospital's policy have elapsed, or the patient does not want an evidentiary examination, still perform a full history and a physical examination, provide a pregnancy and sexually transmitted disease profile access, and refer for follow-up medical care and a rape crisis counseling. General physical, like coming to the physical examination part. Now in this, we will be seeing the, wait a second, sorry for the interruption. I'm really sorry about this interruption. So coming to the physical examination, in this normally we will do a physical examination in which there are general physical examination and forensic examination. Okay, and the laboratory testing will be following them. So in the physical exam, general examination, we must record the patient's general information such as vitals and vital signs, and mental status. After clothing is properly removed and stored, perform a head-to-toe inspection and look for injuries. Focus on defensive injuries such as extremities and carefully check potential areas of injury such as oral cavity in neck for strangulation signs and breast, thighs, and buttocks. Despite all injuries and describe all injuries and record all areas of tenderness if there is no outward sign of injury. Injury is predominantly bruises, bruise, bruises are often located on the limbs, more common, and the face and the torso, with the most assault victims sustaining a light 44% out of moderate injuries. Other non-genital injuries include abrasions, lacerations, and bites and burns. Okay. Then coming to the forensic examination, it includes collection of head and pubic hair and buccal swabs for DNA comparison, photograph of injuries, vaginal and perineal examination, often with colposcopy. Tell the patient what the examiner is doing at each stage of process. Tell the patient she can take a break at any point during the examination. Assemble all of the needed equipment for the forensic examination. Throughout the examination, keep the patient's body covered as much as possible. Have several pairs of gloves available for different parts of the body. Different parts of the body for examination, and change gloves between physical and genital exam. And again between genital and anal exam. Detailed list of equipment and demonstration of examination and evidence collection are available. Okay, we need to take the photographs of abrasions, bruises, contusions, lacerations, bite marks, burns, areas of erythema, hematoma, incisions, petechiae, swelling. Okay. Document location, position of the patient, position of injury using a clock face reference. Traditionally, when the patient is in lithotomy position, the pubic bone is at 12 o'clock position, and the left hip at 3 o'clock, the right hip at 9 o'clock. Begin photographic series with the photograph of the patient's face and end with a photograph of the patient's hospital wristband. So traditionally, when the patient is in lithotomy position, the pubic is in lithotomy, then it will be in the 12 o'clock, right? So the hip at 3 o'clock, the right hip at left hip at 3 o'clock, and right hip at 9 o'clock. Begin the photographic series of the patient's face and end with a photograph of the wristband. So if the photography is not available, describe the signs of the trauma and areas of tenderness in detail using a body map. So we can begin now a genital examination with the combing of pubic hair and extraction of the hair samples. Patients can pluck their own hair and make sure that the hair root is not included. Examine the genital and rectal areas for injuries and signs of trauma. Note any vaginal discharge, vaginal abrasions, cervical abrasions, and cervical lacerations. In some institutions, a topical application of the toluene blue dye is used to highlight the microtrauma. Toluene is a dye with affinity for DNA and RNA. When placed on the area where a topical non-nuclear layer has been removed, toluene blue uh, will be taken up by the underlying cellular tissue. It is typically mixed for use by the hospital pharmacy. Toluene is applied to the external vulva, especially the posterior fourchette, but not under the mucous membrane. Toluene dye is used. Do not perform a speculum examination until after the toluene dye is complete. Because the speculum examination itself may induce some small operations that can be confused with injuries from the assault. Okay, so that's why we must first complete the toluene blue dye, and after that we can do the speculum examination. After the examination, remove excess dye with a water soluble lubricant. The solution is not used soon after it is mixed. Cover the bottle with aluminum foil. Store at 4 degrees centigrade. and bring to room temperature before use. An alternative to bottles of the Thalden Blue is commercially available forensic blue swabs. Now coming to the colposcopy. Colposcopy detects injuries not visible to the naked eye. In one study, only 34% of the genital lesions were seen with the naked eye. 49%, like 49% were seen with the colposcopy, and 52% were seen with the toluidine blue dye. The colposcope is used to photograph injuries, document magnification. If the reports in penetration, if the patient reports anal penetration, examine the anus and rectum for the abrasions or lacerations. Finally, darken the room and scan the entire body surface with a boot lamp to detect traces of semen. Swab areas where the perpetrators made any oral contact, and swab areas that illuminate with the boot lamp. Dry and label all the swabs and add to the rape kit. After all the evidence is collected, make sure to maintain the chain of the custody. Do not leave the kit unattended. Each party that releases and accepts the evidence kit must sign, date, and time the chain of evidence form. If the form are not present to receive the evidence, store the kit in a locked cabinet specifically designated for this purpose. Many rape kits contain elements that require refrigeration. In this case, when police are not available to accept the kit, store the entire kit in the locked refrigerator, only used for store rape kit. Okay, this completes this video. Thank you very much.